Hello everyone and welcome back to Learn English with Podcasts. I'm Jack.
And I'm Emma. Today's episode is going to be very insightful as we're exploring the topic of physical therapy and rehabilitation. This field plays a crucial role in helping people recover from injuries, manage pain, and improve their overall physical function.
That's right, Emma. Whether you're someone in need of physical therapy, a healthcare professional, or simply curious about this area, we'll cover a range of topics to help you understand the importance and the process of physical therapy and rehabilitation. Emma, let's start with the basics. What exactly is physical therapy?
Physical therapy, also known as physiotherapy, is a healthcare profession that focuses on helping individuals restore and maintain physical function, mobility, and quality of life. It's commonly used to treat people who have been injured, undergone surgery, or suffer from chronic pain or medical conditions that affect their movement.
So physical therapy isn't just for athletes or people with sports injuries?
Exactly, Jack. While athletes often benefit from physical therapy, it's also crucial for people recovering from surgeries, those with conditions like arthritis or stroke, and even individuals looking to improve their posture or prevent future injuries.
Emma, what are some common conditions that physical therapy can help with?
Physical therapy can address a wide range of conditions including musculoskeletal issues such as back pain, neck pain, and joint problems like arthritis. Post-surgical rehabilitation recovery after surgeries like knee replacement, rotator cuff repair, or spinal surgery. Neurological disorders including stroke, multiple sclerosis, and Parkinson's disease. Sports injuries such as sprains, strains, and tendinitis. Pediatric conditions including developmental delays, cerebral palsy, and scoliosis in children.
That's a broad range. Can you give an example of how physical therapy helps someone with a common issue like back pain?
Certainly. For someone with back pain, physical therapy might involve exercises to strengthen the core muscles, stretches to improve flexibility, and techniques like manual therapy or massage to relieve pain. The therapist would also educate the patient on proper posture and body mechanics to prevent future injuries.
Let's talk about the role of a physical therapist. What exactly does a physical therapist do, Emma?
A physical therapist, or PT, is a licensed healthcare professional who evaluates, diagnoses, and treats individuals with conditions that limit their physical abilities. They develop personalized treatment plans based on a patient's specific needs and goals. The role of a PT includes assessing physical function, creating exercise programs, applying therapeutic techniques, and educating patients on how to manage their condition.
So it sounds like physical therapists are involved in every step of a patient's recovery process.
Exactly. PTs work closely with patients to help them regain strength, mobility, and independence. They also collaborate with other healthcare professionals, such as doctors, nurses, and occupational therapists, to provide comprehensive care.
Emma, what happens during the initial assessment when someone starts physical therapy?
The initial assessment is a crucial first step in physical therapy. During this assessment, the physical therapist will take a medical history, discuss the patient's medical history, current symptoms, and any relevant information about their condition or injury. Conduct a physical examination. This may include assessing range of motion, strength, flexibility, posture, and functional mobility. Identify problem areas. The PT will identify specific areas that need improvement or are contributing to the patient's pain or limitations. Set goals. The patient and therapist will set realistic, achievable goals for the therapy, such as reducing pain, increasing strength, or improving mobility.
That sounds comprehensive. How long does this initial assessment usually take?
It typically takes about 45 minutes to an hour. The therapist uses this time to gather detailed information to create an effective treatment plan tailored to the patient's needs.
Once the initial assessment is complete, what's the next step in the physical therapy process?
After the initial assessment, the physical therapist develops a personalized treatment plan. This plan outlines the specific exercises, therapies, and activities that will help the patient achieve their goals. The plan may include therapeutic exercises to improve strength, flexibility, and endurance. Manual therapy hands-on techniques such as massage, mobilization, or manipulation. Modalities use of heat, ice, ultrasound, or electrical stimulation to manage pain and inflammation. patient education instructions on how to perform exercises at home, use of assistive devices, and lifestyle modifications.
Can you give an example of a treatment plan for someone recovering from knee surgery?
Sure. For a patient recovering from knee surgery, the treatment plan might include early-stage gentle range of motion exercises, ice therapy, and electrical stimulation to reduce swelling. Mid-stage strengthening exercises focusing on the quadriceps and hamstrings and balance training. Late-stage functional exercises like walking, climbing stairs, and eventually more dynamic activities like jogging or jumping, depending on the patient's progress and goals.
Emma, let's discuss some of the common techniques used in physical therapy. What are some examples?
Physical therapists use a variety of techniques depending on the patient's needs. Some common techniques include manual therapy techniques such as joint mobilization, soft tissue massage, and myofascial release to improve movement and relieve pain. Exercise therapy structured exercise programs to strengthen muscles, improve flexibility, and enhance cardiovascular fitness. Hydrotherapy exercise and therapy performed in water to reduce stress on joints while improving strength and mobility. Electrotherapy, the use of electrical stimulation to reduce pain, improve muscle function, and promote healing. Ultrasound therapy uses sound waves to promote tissue healing and reduce inflammation.
How do therapists decide which techniques to use?
The choice of techniques depends on the patient's condition, stage of recovery, and goals. For example, manual therapy might be used to reduce pain and stiffness early in the recovery process, while exercise therapy becomes more prominent as the patient regains strength and mobility.
Emma, you mentioned patient education as part of the treatment plan. Why is this so important in physical therapy?
Patient education is a critical component of physical therapy because it empowers patients to take control of their recovery. By teaching patients about their condition, proper body mechanics, and self-care strategies, physical therapists help them prevent further injuries, manage pain, and maintain the progress they've made during therapy.
Can you give an example of how patient education might be applied in a real-world scenario?
Certainly. For a patient with chronic back pain, education might include teaching proper posture, body mechanics for lifting and bending, and exercises to strengthen the core muscles. The therapist might also discuss lifestyle changes, such as weight management and ergonomic adjustments at work, to prevent future flare-ups.
Emma, let's focus on rehabilitation after surgery. What role does physical therapy play in post-surgical recovery?
Physical therapy is essential in post-surgical recovery, helping patients regain mobility, strength, and function after surgery. It can also prevent complications such as stiffness, muscle atrophy, and scar tissue formation. The rehabilitation process usually starts soon after surgery, with the intensity and type of therapy gradually increasing as the patient heals.
Can you walk us through the phases of post-surgical rehabilitation?
Sure. Post-surgical rehabilitation typically involves 3 phases. Phase 1 early recovery focuses on reducing pain and swelling, protecting the surgical site, and beginning gentle range of motion exercises. Phase 2 intermediate recovery involves more active exercises to improve strength, flexibility, and mobility. Functional activities, such as walking or stair climbing, may also be introduced. Phase 3 late recovery aims to restore full function, with more challenging exercises and activities that simulate daily tasks or sport-specific movements. The goal is to return the patient to their previous level of activity safely.
Emma, how does physical therapy help individuals with neurological conditions like stroke or Parkinson's disease?
Physical therapy plays a vital role in helping individuals with neurological conditions regain and maintain their physical function. For stroke survivors, therapy focuses on improving mobility, balance, and coordination, as well as retraining the affected limbs. For individuals with Parkinson's disease, physical therapy can help manage symptoms such as stiffness, slow movement, and balance issues.
Can you give examples of specific exercises or therapies used for these conditions?
Certainly. For stroke rehabilitation, exercises might include gait training to improve walking, balance exercises to prevent falls, and strength training for weakened muscles. For Parkinson's disease, therapy may involve exercises to improve flexibility, posture, and coordination, as well as techniques to manage freezing episodes during movement. The goal is to help patients maintain independence and improve their quality of life.
Let's talk about sports rehabilitation, Emma. How does physical therapy help athletes recover from injuries and return to their sport?
Sports rehabilitation is a specialized area of physical therapy focused on helping athletes recover from injuries and return to their sport safely and efficiently. This type of therapy not only addresses the injury itself but also works to prevent future injuries by improving strength, flexibility, and overall athletic performance.
What might a sports rehabilitation program include?
A sports rehabilitation program typically includes injury-specific exercises to restore function and strength to the injured area, functional training exercises that mimic the movements of the sport to ensure the athlete is ready to return to play, agility and plyometric drills to improve speed, power, and coordination, injury prevention techniques including strengthening exercises for vulnerable areas, education on proper technique, and conditioning to reduce the risk of re-injury.
Emma, physical therapy isn't just for adults, right? How does pediatric physical therapy differ and what conditions does it address?
That's correct, Jack. Pediatric physical therapy focuses on helping children with developmental delays, congenital conditions, injuries, and other challenges that affect their movement and physical abilities. The therapy is tailored to each child's developmental stage and specific needs, with an emphasis on improving motor skills, balance, coordination, and strength.
Can you give examples of conditions treated by pediatric physical therapy?
Certainly. Pediatric physical therapy can help with conditions such as cerebral palsy, helping children improve mobility, balance, and coordination through exercises and assistive devices. Developmental delays, working with children who are slow to reach milestones like crawling, walking, or running. Scoliosis, providing exercises to improve posture and spinal alignment. Injuries, assisting children in recovering from fractures, sprains, or surgeries with age-appropriate exercises and therapies.
What about geriatric physical therapy, Emma? How does it help older adults maintain their health and mobility?
Geriatric physical therapy is designed to address the unique needs of older adults, helping them maintain or improve their physical function, mobility, and independence. This type of therapy often focuses on managing chronic conditions, reducing the risk of falls, and improving the quality of life for seniors.
What are some common conditions treated by geriatric physical therapy?
Common conditions include osteoarthritis, exercises and therapies to reduce pain and improve joint mobility. Osteoporosis, weight-bearing exercises to strengthen bones and reduce the risk of fractures. Balance disorders, balance training to prevent falls and improve stability. Post-surgical rehabilitation, helping seniors recover from joint replacements, hip fractures, or other surgeries.
Emma, technology is advancing rapidly in all fields, including physical therapy. How is technology being used to enhance physical therapy and rehabilitation?
Technology is playing an increasingly important role in physical therapy, offering new tools and methods to enhance treatment. Some examples include virtual reality (VR) used to create immersive environments for rehabilitation exercises, particularly for balance and coordination training. Wearable devices such as activity trackers and smart clothing, which monitor movement and provide real-time feedback to patients and therapists. Telehealth allows patients to receive physical therapy remotely through video consultations and virtual exercise sessions. Robotics used in gait training and rehabilitation for individuals recovering from stroke or spinal cord injuries.
It's amazing how technology is changing the field. Do you think it will eventually replace traditional physical therapy methods?
Technology is a powerful tool, but it's most effective when used in conjunction with traditional physical therapy methods. The human touch, personalized care, and hands-on techniques provided by physical therapists are irreplaceable. Technology enhances and complements these methods, making therapy more effective and accessible.
Emma, physical therapy isn't just about the body, is it? What role does psychology play in the rehabilitation process?
You're absolutely right, Jack. The psychological aspect of physical therapy is crucial, as mental and emotional well-being greatly influences the recovery process. Patients may face challenges such as frustration, anxiety, or depression, especially when dealing with chronic pain or long-term rehabilitation.
How do physical therapists address these psychological challenges?
Physical therapists support patients emotionally by providing encouragement, setting realistic goals, and celebrating progress, no matter how small. They also educate patients on the mind-body connection and teach techniques like relaxation exercises and mindfulness to manage stress and pain. In some cases, therapists may collaborate with psychologists or counselors to provide comprehensive care.
Emma, how important is it for patients to adhere to their physical therapy program?
Adherence to a physical therapy program is critical for achieving successful outcomes. Consistency in attending sessions, performing prescribed exercises at home, and following the therapist's recommendations significantly impacts the speed and quality of recovery.
What challenges do patients face in adhering to their therapy, and how can they overcome them?
Common challenges include time constraints, lack of motivation, pain, or simply forgetting to do exercises. To overcome these, patients can set a routine, incorporate therapy exercises into their daily schedule, track progress, use a journal or app to record progress and stay motivated. Communicate, keep an open line of communication with their therapist to address any difficulties or concerns. Seek support, involve family or friends for encouragement and accountability.
Emma, can you share some real-life success stories of people who have benefited from physical therapy?
Absolutely, Jack. Here are a few inspiring stories. John's recovery from stroke. After a severe stroke, John struggled with mobility and balance. Through dedicated physical therapy, including gait training and balance exercises, he regained his ability to walk independently and returned to his favorite activities like gardening. Sarah's post-surgery rehabilitation. Sarah underwent knee replacement surgery and faced a long recovery. With a personalized therapy program focusing on strength, flexibility, and functional exercises, she not only recovered but also exceeded her previous fitness levels, participating in a charity 5K run just a year later. Emily's battle with chronic back pain. Emily suffered from chronic back pain that affected her work and daily life. Physical therapy, which included core strengthening, manual therapy, and education on posture, helped her manage her pain effectively. She now enjoys an active lifestyle without the limitations of pain.
Emma, what are some future trends in physical therapy that we should be aware of?
The future of physical therapy is exciting, with several trends likely to shape the field. Personalized medicine. Advances in genetics and data analysis will allow for more personalized treatment plans tailored to an individual's specific needs and characteristics. Integration of AI. Artificial intelligence will enhance diagnostics, treatment planning, and progress tracking, providing therapists with powerful tools to optimize care. Increased use of telehealth. Telehealth will continue to grow, making physical therapy more accessible to people in remote areas or with mobility challenges. Focus on preventative care. Physical therapy will increasingly focus on prevention, helping people maintain their health and prevent injuries before they occur.
Emma, how does physical therapy vary in different parts of the world? Are there global differences in practice or access?
Yes, there are significant global differences in the practice and accessibility of physical therapy. In high-income countries, physical therapy is widely available and integrated into healthcare systems with a focus on evidence-based practice. However, in many low- and middle-income countries, access to physical therapy can be limited due to a lack of trained professionals, resources, or healthcare infrastructure.
What efforts are being made to address these disparities?
International organizations like the World Confederation for Physical Therapy (WCPT) work to promote the development of physical therapy services worldwide. There are also initiatives to train more physical therapists in underserved areas and to use technology, like telehealth, to bridge gaps in access. Collaborative global efforts aim to ensure that people everywhere have access to the physical therapy services they need.
Emma, how important is the role of family and caregivers in the rehabilitation process?
Family and caregivers play a crucial role in supporting patients through rehabilitation. Their involvement can make a significant difference in the patient's motivation, adherence to the therapy program, and overall well-being. Caregivers often assist with exercises, help with daily tasks, and provide emotional support.
How can physical therapists involve family members in the rehabilitation process?
Physical therapists often include family members in the education and training process, teaching them how to assist with exercises or manage the patient's condition at home. This collaborative approach ensures that the patient receives consistent support and care, both in and out of therapy sessions.
Emma, what about group physical therapy? How does it differ from individual sessions, and what are its benefits?
Group physical therapy involves treating multiple patients with similar conditions in a group setting. This approach offers several benefits. Social support. Patients can encourage and motivate each other, reducing feelings of isolation. Cost-effectiveness: group therapy is often more affordable than individual sessions. In diverse interaction, patients learn from each other's experiences and progress.
Are there specific conditions or situations where group physical therapy is particularly effective?
Group physical therapy is especially effective for conditions like arthritis, stroke recovery, and chronic pain management, where peer support and shared experiences can significantly enhance motivation and outcomes.
Emma, how do physical therapists adapt treatments for special populations such as pregnant women or individuals with disabilities?
Physical therapists tailor their treatments to meet the unique needs of special populations. For pregnant women, therapy focuses on managing pregnancy-related pain, improving posture, and preparing for labor. For individuals with disabilities, therapy is adapted to address specific functional goals, whether it's improving mobility, enhancing independence, or using assistive devices effectively.
Can you give specific examples of adapted physical therapy?
Certainly. For pregnant women experiencing lower back pain, physical therapists may prescribe gentle stretching and strengthening exercises that are safe during pregnancy. For individuals with spinal cord injuries, therapy might include using specialized equipment to assist with standing or walking, as well as exercises to maintain upper body strength and prevent complications like pressure sores.
Emma, how does physical therapy help with chronic pain management?
Physical therapy is an effective approach to managing chronic pain by addressing the underlying causes of pain, improving mobility, and teaching patients how to move safely without exacerbating their pain. Therapists use a combination of exercises, manual therapy, and education on pain management techniques to help patients regain control over their lives.
What are some common techniques used in physical therapy for chronic pain?
Common techniques include strengthening exercises to support joints and reduce strain on painful areas, stretching and flexibility exercises to relieve tension and improve range of motion, manual therapy to reduce muscle tension and improve circulation, pain education teaching patients about the nature of chronic pain and strategies to manage it, such as pacing activities and relaxation techniques.
Emma, how important is nutrition in the rehabilitation process?
Nutrition plays a vital role in rehabilitation, as it supports healing, energy levels, and overall physical performance. Proper nutrition can enhance the body's ability to recover from injury, surgery, or illness, and can help maintain muscle mass and strength during rehabilitation.
Can you provide examples of how nutrition and physical therapy work together?
Certainly. For instance, patients recovering from surgery or injury need adequate protein intake to repair tissues and build muscle. Similarly, hydration is essential for maintaining flexibility and preventing cramps during physical therapy exercises. A balanced diet rich in vitamins and minerals can also support bone health, which is crucial for patients with osteoporosis or fractures.
Emma, what about physical therapy for cardiac rehabilitation? How does it help patients recover after a heart attack or surgery?
Cardiac rehabilitation is a specialized form of physical therapy that helps patients recover from heart-related events, such as heart attacks or surgeries like bypass operations. It focuses on improving cardiovascular health, increasing physical fitness, and reducing the risk of future heart problems.
What does a cardiac rehabilitation program typically include?
A cardiac rehabilitation program typically includes supervised exercise aerobic exercises such as walking, cycling, or swimming to improve heart function and endurance. Education information on heart-healthy lifestyle choices, including diet, exercise, and stress management. Risk factor management strategies to control blood pressure, cholesterol, and other risk factors for heart disease. Emotional support counseling or support groups to help patients cope with the emotional impact of heart disease.
Emma, physical therapy isn't just for treating injuries or conditions, is it? How does it play a role in preventive health?
That's correct, Jack. Physical therapy plays a significant role in preventive health by helping individuals maintain mobility, strength, and overall physical function. It's not just about rehabilitation, it's also about preventing injuries, managing chronic conditions, and promoting a healthy, active lifestyle.
Can you give examples of how physical therapy is used preventively?
Certainly. For example, physical therapists might work with athletes to develop injury prevention programs that include strength training, flexibility exercises, and proper techniques. For older adults, therapy can focus on fall prevention through balance training and strength exercises. For individuals with desk jobs, Physical therapy might involve ergonomic assessments and exercises to prevent posture-related issues like back and neck pain.
Emma, how does physical therapy impact a patient's overall quality of life?
Physical therapy has a profound impact on a patient's quality of life by improving their physical function, reducing pain, and helping them regain independence. Whether it's enabling someone to walk again after surgery, helping an athlete return to their sport, or allowing a senior to live independently, physical therapy plays a crucial role in enhancing the quality of life for people of all ages.
Can you share a specific example of how physical therapy improved someone's quality of life?
Absolutely. Take, for example, a senior who had lost confidence in walking due to a fear of falling. Through balance training and strength exercises in physical therapy, she regained her confidence, started walking independently, and was able to participate in social activities she had previously avoided. This not only improved her physical health but also her emotional well-being and social life.
Emma, we've covered a lot of ground in this episode. What are your final thoughts on physical therapy and rehabilitation?
Physical therapy and rehabilitation are essential components of healthcare, offering individuals the opportunity to recover from injuries, manage chronic conditions, and improve their overall physical function and quality of life. The field is continuously evolving with new techniques, technologies, and approaches that enhance patient outcomes. Whether you're a patient, a caregiver, or a healthcare professional, understanding the importance and benefits of physical therapy can make a significant difference in the recovery and well-being of those in need.
I couldn't agree more, Emma. Physical therapy is a vital resource that helps people live healthier, more active lives.
Absolutely, Jack. We encourage our listeners to consider physical therapy as a proactive approach to their health and to seek professional guidance whenever they experience pain, injury, or mobility issues.
That concludes our extended episode on physical therapy and rehabilitation. We hope you found it educational and inspiring.
Thank you for joining us on this journey through the world of physical therapy. We appreciate your support and encourage you to stay engaged with this important topic.
Don't forget to subscribe to our podcast and like this video. Your engagement helps us continue to bring you informative and valuable content.
Until next time, this is Emma.
And this is Jack. Goodbye. Bye.
Remember to leave a review and share this podcast with your friends. Together we can learn and make a difference.